Hi, welcome back. This is Adam Rosen. Today I'm going to talk to you about something a little lower than the knee. We're going to talk about the foot and specifically heel pain, something termed plantar fasciitis. And unfortunately, some of you may have suffered from this. So you probably had this if you were one of those people that woke up, first step out of bed, had this shooting, searing heel pain right in the bottom of your heel, and you limped around, and 5, 10, 15 steps, it starts to loosen up. And that's the classic symptom that people present with. And if they've had it for a long period of time, it becomes chronic. So patients will commonly bring this up in the office. And these are the top 4 things that I have explained to my patients that have been very helpful for them to improve their symptoms and reduce their pain. So what is the plantar fascia? The plantar fascia is this band of tissue, this fibrous tissue that runs from the heel, the base of the heel or the calcaneus, all the way up to the base of the toes, and it helps maintain the arch of our foot. But when that band gets tightened, it can pull on the insertion or anywhere along the band, and it can be painful. So the first thing that I recommend to my patients is to get a water bottle, one of the round ones, take a little water out of it, stick it in the freezer, and let it freeze solid. And then what you'll do is this technique, which both ices to reduce the pain and the inflammation and stretches the plantar fascia. So what you can see here is I'll lay this bottle on the floor, put my foot on top of it, and just roll the foot back and forth. You might do it for a minute, 2 minutes, 3 minutes, 5 minutes, as long as you are comfortable doing it. And you can put a little bit or a little less force on your leg with your hands or your leg muscles to push into this bottle to stretch that tissue a little bit more. Once you're able to do that, then the second thing that you're going to do is cross your legs. So you'll put your left foot ankle up on top of your right knee or vice versa if it's the other leg. Use the same hand. So if it's your left foot, you'll use your left hand, grab your toes, pull your toes up, your ankles up, and you'll see or feel that band, that plantar fascia tighten. And then you want to take your thumb and you want to push and rub and push and rub and push and rub and stretch to reduce that tightness and loosen that up. And that's why it's important to do the icing first, because it freezes that area and it makes it less painful when you now push on it. The third and the fourth thing are stretches. So what you'll do here are 2 stretches for your calf muscle, one for the gastrocnemius or the gastroc. And what you see here is my hands are up on the wall. The back leg is the one that we're stretching. You want to try to keep your heel down. You can do this with shoes or without. I'm wearing shoes here. And you want to keep your knee straight and lean into it. Hold it for 10 seconds. If you're able to, hold it for 30 seconds, and you can repeat a few times. It's good to do it on the other leg, even if you don't have pain on that one. And then you can switch and do this other stretch where you'll put your feet about shoulder width apart, put your hands again on the wall, and bend your knees. You'll feel that second muscle in your calf called the soleus stretch. And if you don't feel it with your legs together, lined up the same distance from the wall, you can take the affected leg and drop it back a shoe length. So the toes of your bad foot are in line with the heel of your good foot, and you might feel more of a stretch at that point. Sometimes people will even like doing this on a stair, so you can hold onto the stair railing and use the balls of your feet on the stair and drop your heels down. It's just another way that you can stretch the calf muscle and the gastroc soleus. So those are the 4 things. So icing it with the bottle, stretching it manually, doing these 2 stretches for the gastroc and the soleus. What else? Are there other things that you can do? So some people will find a course of an anti-inflammatory, a pill like ibuprofen or naproxen can help if there's not a contraindication for you to take it. Some people will use a anti-inflammatory cream, so diclofenac gel, which you can buy over the counter, you can rub on the foot. Some patients have even found that night splints have been helpful. I've found many patients that they do buy night splints. You can buy these online, and I'll put a link in the show notes. A lot of times they have difficulty falling asleep because you have this contraption on your foot, or they get it on, they fall asleep, and then they kick it off in the middle of the night. But it can be helpful for some people, so it's worth trying if you've tried other things and are still having problems. A heel pad can be helpful too. You can get these over-the-counter heel cushions that have a little cutout while you're going through this process. And occasionally your doctor might talk to you about doing a cortisone injection. There are 2 really good resources that I'll put links in the show notes from the Academy of Orthopedic Surgeons and the Foot and Ankle Society. So those both have informational links that I will put in the show notes that you can get some more information. What about the spur? People will ask about the spur. And there have been studies that have looked at this where there are a lot of people that have a heel spur on an x-ray and don't have or have never had plantar fasciitis. And there are a lot of people that have plantar fasciitis and have never had a heel spur. So you can get a heel spur if you have plantar fasciitis, but it has not been proven to be the cause of the problem. So there you have it, whole bunch of information. If you have plantar fasciitis or this heel pain, 4 important things to do: icing technique, manual stretching, stretch your gastroc, stretch your soleus, and then a few other extra things in there that you might find helpful. So I hope this has answered some of the questions that you may have had, something to get you started. Definitely seek out care in your local area if you're one of the people that continues to suffer from this. And check out those links that I will put in the show notes so you can get a little bit more information. Thanks again for watching. If you enjoy this information and haven't already subscribed, please subscribe. You can click the little bell button in the bottom. That'll alert you when new videos come up. And if you enjoy this information, be sure to leave a thumbs up. It helps people like you find information like this. Until next time, I'm Adam Rosen. Thanks for watching. Stay safe.